Mesothelioma is an aggressive cancer caused by previous exposure to asbestos. As the disease progresses, it causes significant illness and pain for those afflicted. While conventional medical treatments such as surgery, chemotherapy, and radiation are available, some patients seek out complementary alternative therapies including various herbal remedies. Below is an examination of some of the most commonly used herbal therapies for mesothelioma and their potential side effects. Turmeric contains a compound called curcumin that has been researched for its anti-inflammatory and antioxidant properties. Some studies have found it may help slow cancer growth. However, turmeric can potentially interact with medications metabolized by the liver like chemotherapy drugs. In large amounts, it may cause nausea, dizziness, and diarrhea. Turmeric should be avoided before surgery as it can increase the risk of bleeding. It is always wise to consult a doctor before combining turmeric with standard cancer treatments. Mushrooms such as shiitake, maitake, and reishi have shown some anti-cancer activity in animal and test tube studies through invoking the body's immune response. Medicinal mushrooms are well tolerated for most people in recommended doses but can cause stomach upset, allergic reactions, or unsafe drops in blood pressure in rare cases. Of particular concern is the potential for negative interactions with chemotherapy and immunosuppressive drugs used to manage mesothelioma symptoms. More research is still needed on safety and efficacy when combined with standard therapies. Astragalus is an herb employed commonly in traditional Chinese medicine that may boost immune function and inhibit tumor growth factors based on limited research. However, astragalus could interfere with cancer treatments by enhancing immune responses too much. Side effects are usually mild at recommended dosages but may include headache, upset stomach, and skin rashes. Long-term safety is uncertain, especially for people with weakened immune systems already coping with cancer. Pregnant or breastfeeding women should avoid astragalus altogether due to lack of safety information. Milk thistle seeds contain silymarin, which is believed to help detoxify the liver and protect against cancer based on test tube evidence. Possible side effects include upset stomach, loose stools, headaches, and menstrual issues. As silymarin influences liver enzymes, it could negatively interact with chemotherapy or alter the effectiveness of other medications requiring liver clearance for safe use. While milk thistle seems to be well tolerated in the short term for most adults, its long-term impact on cancer progression or survival is mostly unknown. Close medical supervision is advised when combining it with standard treatments. Ginger root is frequently taken to relieve nausea from chemotherapy. It contains compounds gingerols and shogeals that calm stomach upset through interacting with serotonin receptors in the gut. Ginger appears quite safe for the majority of adults consuming typical culinary amounts and poses little drug interaction hazards at those levels. However, in very high supplemental doses, ginger could cause heartburn, diarrhea, bleeding issues, and drug interactions involving blood thinners or antiplatelet medications. Due to conflicting data on ginger's anti-cancer properties, its use solely as an anti-cancer therapy outside of medical oversight cannot currently be supported. Medical marijuana and cannabinoids are increasingly employed by mesothelioma patients seeking relief from pain, appetite loss, insomnia, and other disease symptoms or side effects of chemotherapy. While some preliminary studies show promising results in these areas from THC, CBD, and other cannabis constituents, more high-quality research is still warranted. Known risks involve negatively impacting cancer treatment effectiveness and worsening symptoms through drug interactions involving chemotherapy or immunosuppressants. Heavy or long-term marijuana smoking poses hazards from tars and combustion products as well. As the endocannabinoid system influences cancer progression complexly, the safety and efficacy profile of medical marijuana specifically remains uncertain. Considering pros and cons in conjunction with expert medical guidance is advisable. The safety and therapeutic potential of herbal remedies has not been adequately studied in randomized controlled trials for mesothelioma. Patient factors like genetics, liver or kidney function, use of standard therapies, and medical history play significant roles in determining appropriate risk versus benefit ratios of herbal integration. While plant medicines offer promising leads, more research is needed to understand what preparations, doses, administration routes and durations maximize efficacy without compromising treatment outcomes or tolerability. Due to great individual variability, herbal safety and efficacy for mesothelioma can be difficult to generalize. Caution and oversight by expert integrative oncology practitioners are recommended when considering supplementing standard cancer care with herbal medicine. Various herbal therapies show preliminary activity for mesothelioma symptoms or growth-inhibiting effects based on limited evidence. However, side effects and safety profiles are not fully understood, especially with long-term use and when combined with surgery, chemotherapy or radiation. Consultation with medical professionals is paramount to navigating which herbal options, if any, may suit individual health status, goals and treatment plans while avoiding dangerous interactions or interference with standard therapeutic regimens. Rigorous clinical trials are still deficient for herbal remedies in mesothelioma, posing ongoing challenges to definitively advising their safety or efficacy as part of multimodal care or palliation for this serious cancer. An integrative mindset and collaborative relationship with skilled practitioners remain key to prudent and informed herbal decision-making in mesothelioma.